You only need one scan in pregnancy if everything looks fine in the first scan. Is this true? Let us find out. Hello everyone, I'm Dr. Divya Chopra, an OBGYN and an IVF specialist, and welcome to the ninth episode of the Streeveda mythbuster series. So, is this true? No, it's not. Each scan has a different purpose and they are timed for a reason. So, what are the 5 most important scans that every gynec recommends and should be done in each and every pregnancy? Let us find out. So, the first important scan is ultrasound for fetal viability, which you usually do around 6 to 8 weeks of pregnancy. That is around 2 weeks after you find out that you are pregnant. So, we are able to look for 3 important things in that scan. We are able to confirm the location of the pregnancy, whether your pregnancy in the uterus is in the uterus or not. Second thing is we look for the presence of the heartbeat in the baby. And the third thing is the number of sacs in the uterus to confirm whether you are having a single pregnancy or a twin pregnancy. So, coming to the second important scan. So, do you know that we have a scan available which can assess the risk of your baby having a genetic disorder? Yes, it is called as the NT-NB scan, that is nuchal translucency and nasal bone scan. It is done along with a double marker test, which is a blood test, and together this whole panel is called as combined screen. So, coming to the third important scan, which is called as the anomaly scan or level 2 scan. It is done around 18 to 22 weeks of pregnancy, and in this scan we study in detail about the structure and the development of the baby and the baby's organs like brain, the face of the baby, the heart, the stomach, the kidneys, and the limbs. And the anomaly scan and the NT-NB scan are the 2 most important scans in pregnancy to assess the risk of your baby having a genetic and a structural disorder. So, coming to the fourth and the fifth scan, these are called as the growth scans. They help in assessing the growth of the baby, the weight of the baby, the overall development of the baby, the fluid around the baby, which is called as liquor. And there's something called as the Doppler scan, which can also tell us the blood flow, whether the blood flow going to the baby is proper or not. So, now that you know what are the important scans in pregnancy, you also know that each and every scan is important. So, don't miss out on these scans. Follow your doctor's advice and get these scans done on time.